Okay, here's a new scenario. Here's a patient with a UTI. So the patient comes in and says, I think I have a UTI. It burns when I go to the bathroom, and I'm going all the time, and I only go a little bit. This is a 19-year-old patient who's had these symptoms for 24 hours. She denies abdominal pain, fever, chills, or any kind of vaginal discharge. She's healthy, no medications, no allergies. Her vital signs are good, 97.8, 80, 16, and 110/76. So, do we need a life-saving intervention here?
I don't think so.
Okay, how about high-risk criteria or severe pain or distress?
Not hardly. How about just a urine sample?
It sounds like a good plan. Does anybody think she's going to need anything else?
Well, it depends on which physician is working.
Yeah, I'm so glad you brought that up. You know, ESI is based only on the triage nurse's judgment of how many resources she thinks the patient will require to get the patient to a final disposition, whether that's home, admission, or transfer. This judgment is based on her experience and knowledge of emergency medicine, standards of care, and institutional protocols. Physician practice will vary, but ESI has shown that triage nurses do really well at predicting what patients will need.
And remember, the purpose of predicting resources is only to help assign a triage category to the lower acuity patients. The 3s, the 4s, the 5s. So if the story changes and the patient requires more resources, that's okay. You shouldn't triage differently based on how, who's working, how busy the department is. Okay, so let's go back to the case. Sounds like a urine is all we need. One resource, level 4 patient.
But wait, she's going to need a pregnancy test too. And we don't usually send our urines to the lab. We just dip it and then treat when necessary.
Well, let's talk about the pregnancy test first. Bedside testing, if that's what your institution does, doesn't count as a resource. Adding a pregnancy test doesn't change the number of resources. Lab counts as one resource, regardless of the number of tests you send, or the type of specimen. For example, blood or urine or stool.
So this is another great example of some institutional differences that are handled without a problem using ESI. If the case you just discussed, if the urine is never sent to the lab, it is considered a bedside test, does not count as a resource, and the patient is a level 5. If at any point that urine goes to the lab, then we're back to ESI level 4, one resource.